So welcome to the last practice managers meeting of 2023. So I just want to make sure if anyone can give me a thumbs up or just come off of mute and let me know that you can see my screen okay and we're good to get rolling. Thank you, Erica. You were the first thumb I see. All right. So we've got a short agenda, but lots of detail here. So I'm going to get right going. First, we're going to start with some staff updates. So I recognize now, actually, while I was putting this presentation together, that we had just made an announcement in Network News, but had never sent anything formally to our practices. We shared in September that Renee Sutton had stepped down from her position as Senior Director of Provider Network Management and Payer Relations. Since then, I have stepped into the role of Director of Provider Network Management and Payer Relations, so wanted to make sure that everyone was aware of that. Right now, we are moving into the next introduction, which is actually a hello to Molly Parmenter. Molly is not here with us today. She actually starts on Monday, but I wanted to make sure that you all were aware of these transitions that were happening in provider relations. So obviously, once Molly gets here and gets settled, she will start to make introductions to our practices, and we will figure out a plan for who each practice's primary contact is going to be. In addition to those two announcements, we also said farewell to our dear Kate Sharma earlier this month. Kate was in the project director of behavioral health integration role. And so efforts now are underway to search for her replacement. And Elizabeth is hard at work doing that. While we're talking about behavioral health, we will also give a brief update on depression screening and the depression screening initiative for 2023. So this year, the depression screening was a practice level goal to hit 75% of eligible patients over 12 years and older to be screened for depression symptoms. If you did not hit the 75%, we were looking for a 15% increase from the previous year's baseline. We actually made the decision earlier this fall, a few weeks ago, just to award people full points if you are a PCP reward plan eligible provider. So any of our primary care providers who are included in that reward plan will get the full 10% of your reward plan for 2023. We found that we were having difficulties with data capture, and our hope is that the Health Catalyst population health management transformation that we're undertaking in 2024 will improve that data capture. And so with that, we will be planning on providing more information and support on this initiative in 2024. We did share this information with representatives from the adult and peds PCP committees in lieu of the meetings that we were planning on having at the end of November and early December. So if you want to check in with your practices, representatives for those committees for any of the details that were in those emails, please do so. I will pause here. I know Elizabeth's on the call, so I will pause to see if she has anything that she wants to add or if any people have questions about this.
I think you covered it really well. I just wanted to say thank you to everyone who's worked on this year. We know there's been some frustrating data challenges, but that being said, we have actually seen a market improvement across the network in screening for depression. So certainly more to come on this in 2024, but the movement from a patient's reached clinical perspective has been great to see. And as Jana mentioned, we are hoping that we'll get those data issues fixed so that this is a little bit easier on the practices. There's not as much of a burden for you all.
Thank you. Okay. Something that people are always interested to hear about are upcoming incentive payments. So the next incentive payment we plan to make is actually going to be for the third quarter 2023 Excellis clinical integration. We plan on making that next week. So that is our tentative goal to get that done. We've communicated throughout this year that we've had some issues with the MVP attribution reports that we've been getting. Our hope is that those will be, rectified and cleared up this week so that we can also include first, second, and third quarter MVP clinical integration dollars in this upcoming payment. However, if that is not possible, we will then plan to make that payment in early January. Our CFO, Jim Wright, is working very hard with MVP and our partners there to get these reports accurate so that we can make that payment as soon as possible. We know that this is a little frustrating because I know many of you are, depend on these dollars being consistent and coming to you. So we just appreciate your patience as we work through that. So now for the meaty part of this presentation. So as we like to do in December, we do a quick overview of the 2024 employer health plans. So if you'll remember, AHP has 3 direct contracts with employers: FF Thompson's health plan, the University of Rochester's health plan, and also Highland Hospital. So members who, we are the tier 1 benefit network or provider network for those plans. And so members who use AHP providers to obtain their care receive the lowest out-of-pocket expenses. So we really encourage that individuals in those plans see AHP providers, which you all are. So what are the changes that we're seeing across those plans? Really, for FF Thompson, there's been 2 increased deductibles for tier 1 and tier 2, and increased HSA and FSA contribution limits. So for FF Thompson, the tier 1 and tier 2 deductible increase is really a raise to meet the IRS minimum deductible for qualified HSA plans. So that's where you're seeing not just for FF Thompson, but also for the University of Rochester and Highlands HSA plans, the deductible has risen. The HSA and FSA contribution limits, again, is determined by the IRS, and so we're seeing increases there as well across the plans. A reminder, this plan is about 1,600 members. They use Excelis as their only third-party administrator, and there's 2 plans. There's the high deductible plan and the higher deductible plan. I should have changed that because now it's 1,600 and 3,200, and I think they renamed it, so I will update that before I send these out. Both plans are HSA eligible. There's 3 tiers, so tier 1, tier 2, and tier 3 benefits. So that's your AHP, Excelis Blue Cross Blue Shield, and then also your out-of-network benefits. Members in this plan do not have to select a PCP, and then regardless of whether those services are obtained at AHP or in the Excelis network, preventive care is covered at 100%. There have been no changes to the HSA employer contribution, so that remains $500 for individuals on their single plan and $1,000 employee contribution for those on the family plan. But I will share those cards with you just so that you know where to look for the UR Thompson Health Plan. I think some of the redacted material did not come over. We don't want that. So this is really the plan coverage. So like I mentioned, the high deductible and the higher deductible. So for tier 1, you will see that is a $1,600 or $2,500 deductible for the individual, and then $3,200 or $5,000 for the family. For tier 1, so any AHP provider, the plan will pay 80% after the deductible is met, and then that goes through for tier 2. They will pay 70% after the deductible is met and 60% after the deductible is met for any out-of-network benefits. Highland Hospital, we also have a few changes, again, really to reflect that change in the IRS minimum deductible for 2024. So the HSA Saver plan has an increased deductible. We also have they are going to have a new pharmacy benefit. They are switching to Express Scripts. So at the onset of the year, they will automatically send new cards with new information for the pharmacy benefits to individuals in those health plans. So this plan has about 3,800 members. They do have 2 TPAs currently, so that's Excelis Blue Cross Blue Shield and MVP Healthcare. There's 3 plans: the HSA Saver, which is their HSA high deductible plan, Healthy Basics, and then Health Advantage. Similar to FF Thompson, none of these require that members select a PCP. Preventive services are covered at 100%. The only difference here, and we shared this last year, but for 2023, and that is continuing into 2024, MVP does not provide any benefits. Highland Hospital does not provide any benefits for out-of-network, so those tier 3 services. They have maintained their employer contributions, so single and family contributions for those two plans remain the same. This is what those cards look like. Similar, they will be sending new cards with new RX information so that people have those, but we just want to make sure that you can see this is a Highland Hospital card, and this is what it looks like for MVP. Similar for Excelis, they will send new cards with RX information, but this is for those 3 plans that folks can choose from. So what does that look like for Highland Hospital? You'll see that increased in the individual and family minimum deductibles for tier 1. The tier 2 benefits and their deductibles are already above that threshold, so there were no changes there. Anything that is covered that is not a preventive service at the primary care office, specialist visits, or urgent care is a 90%, 10% co-insurance. So after that deductible is met, that's where the plan kicks in on the HSA. For the Healthy Basics EPO, the plan that is a lower deductible, it's a copay plan. So the you'll see the copays listed there: $30 for a PCP visit, $45 for a specialist visit, and $50 for urgent care. Similarly, the Health Advantage PPO plan has a higher deductible, but similar copays, and in urgent care is listed as a 90%, 10% coinsurance for the tier 1 benefits. You'll see the difference in tier 2 benefits. So that's utilizing either the Excelis or MVP network. So individuals who are not in AHP, but are in the Excelis or MVP provider networks. Any questions before I go into the big one that has the most change, which is changes for 2024, which is the UR Health Plan? Okay, you guys might get really lucky. Might get through this pretty quick. So the UR Health Plan has the most changes of the plans for 2024. So we've seen, similar to the other 2, increases in the FSA and HSA contribution limits, and then also increases to the tier 1 high deductible for the HSA plan. There's also a change to the urgent care benefit, which I'll talk about. And the UR Health Plan is also switching pharmacy benefits, so they will send new cards with new RX information to members. This is the largest of the health plans that we contract with. So this is about 38,000 members we're estimating for 2024. They only have the Excelis TPA. They used to have 2, and they switched a few years ago to only Excelis as their TPA. There's 2 plans. There's the copay plan, and then there's the HSA plan. Both have 3 tiers: AHP, Excelis, and out-of-network benefits. No PCP required. And services for preventive care are covered at 100%, regardless of whether they're AHP or Excelis network. The HSA employer contribution has remained the same for single and family individuals. What has changed is they increased the threshold for the employer contribution. So for the University of Rochester, last year, the threshold was $64,900 is the limit. After that salary, they would no longer submit or provide employer contributions, and they've raised that threshold to $68,900 this year. These are their cards. You will see your PPO or your HSA eligible plan at the top of those cards. So any of these individuals are covered by the University of Rochester's health plan. They'll be sending new cards as they do for the upcoming year. So let's break down some of the changes. I decided to put all this on one slide because it is a lot, but it's just easier if you can see the tiers as you're going through this. So you will see that increase in the on the right side for the HSA plan of the deductible. What I want to call out is the urgent care benefit on the bottom. So it used to be that the PPO plan, the urgent care benefit was subject to a deductible. So the plan would pay 90% for any urgent care services after the individuals met their deductible. They have changed that. So for the PPO plan, it is $35 copay if you use an AHP urgent care facility. Similarly, for the HSA plan, it used to be just a 90% coverage after you had met your deductible. And now the plan is switching to after an individual meets their deductible, they will it's a $35 copay for urgent care services. This is new, but they're doing this really to align with how urgent care is covered in some of their other plans and service models. Any questions? Comments, concerns? Okay. So what should you do if you're having claims issues or a patient says that they're having claims issues? Most commonly what we hear is that your practice is a tier 1 benefit, but you cannot, but your claims aren't processing as, they're processing as tier 2. Or that it's a service that isn't tiered. So like behavioral health, that's not a tiered service, or DME is not a tiered service, and for some reason it's processing with a tier 2 copay. The benefit for some of those untiered services is the same, and so the tier 1 benefit applies for all. What should you do if you're hearing these? The first step is really to contact the TPA. So that would be Excelis or MVP, depending on the health plan and the patient that you have in front of you. And you want to confirm that you are either it's not a tiered service, or that they do recognize you as a tier 1 provider. If those two things can't be confirmed, or you think that they are in error, reach out to myself, or if Molly is your future provider relations rep, reach out to Molly, and we can certainly work with our TPAs to get that fixed for you. I usually leave this room for open discussion. I know typically people don't bring things, but I'd like to, leave space for people to have the questions and anything that they have. But it looks like we might get through this presentation a little quicker than I thought. Is there anything from the folks at AHP that you'd like to share, or from our practice managers on the call that you'd like to ask about? I'm seeing head shakes, nothing in the chat. Okay. All right then. With that, I will share our schedule for the 2024 practice managers meeting. We will have 4 meetings again in 2024. They will be on Wednesday, March 6th, Wednesday, June 12th, Wednesday, September 18th, and then Tuesday, December 3rd. They will remain from 8 a.m. to 9 a.m. And we will continue to have good agendas for you to participate in. Before I finish up, yes, we are an AHP participating provider. This is very important for you and all of your staff to remember, because if a patient in one of these health plans calls and says, "Are you an AHP?" they want to know that the answer is yes. For your patients, please refer them to AHP specialists, hospitals, and imaging and labs. That is where they will get the most benefit, and that is how we can maintain our network's integrity and make sure that folks are getting the highest quality care for the lowest cost. For your practices, please monitor Arcadia and what will be Health Catalyst in the upcoming years, and the provider engagement report for any changes and your quality performance. Also, attend practice managers meeting. As a reminder, attending 2 or more of these a year does count as a citizenship component for all of the providers at your practices. So it's very important that you come. Please accept, read, and share our communications. I know this is something that You know, it's very easy to click unsubscribe or send us to a flag for later, but there's always nuggets of good information there. And whenever possible, help your providers connect with AHP resources. If there's ever a question about something you might need or they might need, please reach out. I always tell people, even if you don't think we do it, we might, so ask the question anyway. Before I get into the very last slides, a reminder, please add your name and your practice to the chat. That is the primary way that we are able to gather attendance for these meetings. So I want to make sure that you do that, and I will stay on for a little bit to make sure that everyone has a chance to do that. Contact information will go out with all of these. So that is for any provider updates, PR questions, optimization, all of those things. All of this contact information will go up in the follow-up slides. And then any contacts for RMS, Medline, or Atlantic Health Partners. Don't ever hesitate to ask a question if you're having difficulty accessing any of the services that we offer. With that, 25 minutes, you're going to get back 40 minutes of your morning, guys. That is a great way to end the year. We are so grateful for 2023 and your participation. We're really looking forward to 2024. I think it's going to be a great year full of great activities and in collaboration with you all. So all the best. I will let you get on with the rest of your days.